Hello, good afternoon, good morning, and good evening to everyone joining to our weekly live Q&A with Dr. Mike Ryan and Dr. Maria Van Kerkhove on COVID-19 updates. If you're watching us on Twitter, use the hashtag AskWHO. If you're watching us on other platforms, as usual, please use the comment section and I will pass your questions to Mike and Maria. We're changing the day today due to some duty travels, but also some other more important events, I would say, because our scientists also have family duties. So, Maria, maybe we can give you a moment to address why we can't be here tomorrow and we are doing this today.
So thanks so much, Alex. So tomorrow is my son Cole's birthday. And so we moved the live Q&A to today so that I could be with him to celebrate his birthday. So happy birthday, Cole, a day early. You are just such a tremendous little human being, and I am so grateful for you. And thank you also for your patience with me during this pandemic, and for Mike and I to do these lives, and for us to be so busy over the last couple of years and to be understanding of that. And here's to a better year 12 for you, but happy birthday. I love you.
Happy birthday.
I need to say happy birthday to him
Yes,
as well.
please. Sorry for
But
interrupting.
also to tell Cole that I still have up in my office, even when we moved buildings, there's only one thing that came with me from one office to the other. Everything was new, and that's a poster that Cole drew for me 2 years ago or more. In very dark days of the pandemic, when things were really difficult and we were under such pressure and we were all so exhausted, and we really felt a bit hopeless. And Cole sent a poster in to me, and it had a rainbow on it, and it said, "Good job." And I can't tell you, I know it sounds very petty and it sounds very small, but I can't tell you the impact that had on us at the office, just to keep going. And I've kept it on the top of my background for many many people see me on other conferences, not here, would see that little poster still up on the top of my background for WHO. So my background when I do Zoom meetings has WHO, OMS, and up in the corner there's a little poster that says "Good job," and that was Cole's work. So thank you, Cole, and happy birthday.
Happy birthday, Cole. And I'm also one of those recipients of a Good Job rainbows, and I have it upstairs. We should actually brought it here for the background.
Yeah,
We'll do
bring
that
it down.
for next session. But also Cole was one of our guests in one of the sessions. I think it was for Children's Day, probably 2 years ago.
Yes, it was over the summer, and it was the first day I was taking off on holiday, and I brought him in, and he joined our Facebook Live, our live Q&A. Yeah.
Thank you. We go a long way back with this pandemic and this conversation, so thank you for that. But maybe one of the traditions is to start with the epidemiological situation. Last week, Dr. Tedros highlighted that the mortality rates are almost 90% lower than in February this year, which is a very encouraging sign. But we still have over 9,000 people dying every week, which is too many. So maybe we start with epidemiological situation and where are the transmission hotspots now, and maybe what are the weakest points in the response at the moment.
So maybe I'll give it a go to give it a start. And I think, what you've highlighted is that we do have some good news, right? So we're in a much better situation than we've ever been in with this pandemic in terms of our ability to manage COVID-19. We are seeing millions of cases being reported to WHO each week. We know that it's a substantial underestimate. The virus is spreading readily around the world, and surveillance has declined. So we don't have a good handle on how many actual cases there are of infections or reinfections. And deaths are down. They are down 90% of where they were at the highest peak. But we are still seeing more than 9,000 deaths being reported to WHO each week. And this is 9,000 too many when we have diagnostics that can get patients into that clinical care pathway and to receive the treatments that they need to prevent deaths from occurring. And because we have so many safe and effective vaccines that work at preventing severe disease and preventing death. So this is, I would say, our weakest point right now in terms of the pandemic, in terms of our response, is making sure that everyone that needs a vaccine is receiving the vaccine. And in particular, those who are at a higher risk for developing severe disease, people over the age of 60, people who are immunocompromised, people with underlying conditions, make sure that they receive the right number of doses that are required for them. And that will depend on where you live, that will depend on the type of vaccine that you received. So it's really important that you get vaccinated. And that remains as important now as it did when those vaccines became available. So please get your vaccine and get the required number of doses that are for you. If we look at the hotspots around the world, the data that I have are about a week old because we're waiting for countries and regions to update their reporting to us. We see increases in case reporting and increases in deaths in our Western Pacific region. We also see an increase in cases and deaths in our Southeast Asia region. But again, it varies in terms of the intensity of the spread, and our ability to be able to report where it's most intense is compromised at the moment because surveillance has changed. We do encourage countries right now to focus on another area of weakness that we would say is really making sure that we continue to track this virus, that we continue to look at the trends, particularly in at-risk populations, and so that we could monitor the virus itself. We can look at the mutations, we could look at the variants that are in circulation. So there's still a huge number of Omicron subvariants that are circulating, more than 300 at the moment. Not one of them is dominant worldwide. There's still a lot that is circulating, and we, as WHO and with our partners, need to be able to track that. So 2 points of weakness, I would say. One is really to encourage and ensure that those who can get vaccinated, we still have a third of the world who haven't received a single dose. So we have to increase vaccination coverage around the world, including 100% of people at risk and 100% of our health workers around the world. We need to encourage good surveillance around the world by government so that we can track this virus and really use the tools that we have. We have great diagnostics, we have great antivirals. They need to be used to save people's lives now.
Thank you so much, Maria. And Mike, maybe you can reflect on, as you're overseeing the global response to this pandemic, what are the weakest parts of the response at the moment, or maybe your major concerns?
I mean, I've said it before. I think as of today, WHO is dealing with 53 different graded health emergencies around the world, COVID being one. And, you know, our highest grade of emergency is grade 1, and we have 5, and grade 2 is the second highest, and it's 28 of those. So, and they're on the acute side. And that's not to mention all of the countries in which we have deep fragility and conflict and vulnerability. So, Mike, and I say that looking at the landscape that we have here at global level, but each country is looking at that similar landscape. They're dealing with lots of other issues. They're dealing with the financial crisis. They're dealing with an energy crisis. They're dealing with the health system that's finding it difficult to recover and deliver the level of service that it delivered previously. We've seen that increasing waiting lists, waiting times for elective surgery, decrease in immunization rates, negative, poorer outcomes for cancer patients, so many different areas that countries are trying to recover in. We have health workers who are, you know, have been very much exhausted over the last 2 years. So Maria spoke to what the virus is doing, and that's very, you know, it's stable but unstable. It's heading in the right direction, but there's lots of energy left in the virus and a few surprises. So it's almost like, yes, it's second half. We're winning. Going back to sports analogies, we're winning the game, but the game ain't over, and there's every chance that the opposition still has energy, still has tactics that can be applied, and we could still see a big surprise. And that's just on the virus behavior side of things. My concern has always been that we're overestimating the inherent capacity of our system to cope, and we're not factoring in the weaknesses that have been built into the system now, baked in by a prolonged period of sustained response. So our infrastructure, our workforce, our agility, our readiness has been deeply affected by almost 3-year response to COVID. And notwithstanding, 30 countries around the world have active outbreaks of cholera. We have lots of other infectious diseases causing stress in systems, from yellow fever to malaria and other diseases. So I'm a bit concerned that we're in a sense continuing to rely on a an underpowered health system to continue to respond to all of these different challenges. So that's one thing. Second thing is the convergence of infections with COVID, RSV virus and influenza virus, particularly in the Northern Hemisphere. We don't know. It's not that one interacts with the other, not at all, but the fact that we're seeing rising rates of RSV, rising rates of influenza, will in itself put more pressure on the health system if we end up with concurrent outbreaks associated with those viruses, and that can affect different age groups. And again, with RSV virus mainly affecting younger persons, that can put more pressure on intensive care systems in some countries, and we're seeing that right now in some places, I think like Canada and others, and that's a normal thing that happens with RSV virus. But again, systems that are still trying to cope with recovering from COVID, having to jump back in to cope with that. And Maria made that point about vaccination. I think it's equally important that people get vaccinated against influenza. Right. If you're over 50, particularly if you have an underlying condition, get your flu shot, get your COVID shot. It's your best bet. And for young, vulnerable people as well. So that's my concerns. And again, it's not to, we keep saying it here, many people around the world have real challenges to their livelihoods. They have challenges to just getting by on a day-to-day basis. COVID is not their highest concern in life, and neither should it be in that sense. There are many things that are putting pressure on people's communities, on people's pockets, on people's health, and we need to be rational and make sure that COVID is seen as part of that sort of range of stressors that we have in our lives, but it's something we can do something about. There are other things that we can't affect. We can't affect the price of energy. We can't affect the national economy and the impact that has on our livelihood. But what we can do is we can affect our outcome in COVID. We can protect ourselves and loved ones from getting exposure. We can get vaccinated and protect ourselves. We can avoid the worst outcomes. We can try to avoid being reinfected and all the consequences that has. So in life, sometimes you have to accept certain things in your life that you have to cope with and adjust to. But there are certain things you can actually genuinely affect the outcome. And thanks to science and thanks to the discoveries in the last couple of years, we have real ways of preventing severe infection with this virus. So we should be applying every single day the principles that we can beat the virus. And I think we continue to make progress, but as Dr. Tedros continually says, we're not there yet. It's like the old thing, are we there yet? Well, we're not there yet. But at the same time, we shouldn't lose hope. We're making progress in the right direction. But as Maria said, we need to focus in on the things that she said that we need to be doing to further win this fight.
Thank you so much, Mike. We are receiving quite a few interesting questions already, and you're both putting accent on the importance of vaccination and being up to date with doses recommended for each of us. But we received a few questions on the importance of masks. So maybe you can highlight the need of using masks and maybe in which settings in particular. And one question was whether N95 masks are still important to be worn in indoor settings.
So this is a great question that highlights what we've been talking about since the beginning, that there is no one solution for COVID-19. We've been talking about this vaccines and strategies, not vaccine only. And even before we had vaccines, we were recommending a number of interventions to reduce your chances of getting infected, and also if you are infected, to reduce your chances of spreading the virus to somebody else, as well as preventing severe disease. And masks are an important part of that. You hear us talking a lot about the do it all, physical distancing, wearing of a mask, wearing of a respirator for certain individuals if you're in particular settings, because you need that heightened level of protection, making sure that we invest in ventilation in the places where we work, where we live, where we study. But it's sometimes as simple as opening windows to have good cross ventilation, because we know the virus can thrive in indoor settings, particularly where there's poor ventilation. It's about good information. Information is one of the tools that we have so that you know what your risk is, so that you can take steps to lower your risk. Using diagnostics appropriately, using therapeutics early in the course of disease all the way through severe disease and vaccination. So it's a number of different types of interventions that need to be used. Masks remain critical to the response. And we continue to recommend the use of masks. From the beginning, we recommended anyone that had symptoms, anyone caring for individuals to wear masks. That was expanded to individuals who were at a higher risk in indoor settings. Again, when we learned more about this virus and we learned the different ways and the many ways in which this virus spreads. We continue to recommend the use of masks, particularly in indoor settings. For health workers, we still recommend universal masking in health facilities. That means anyone in those facilities to wear a medical mask, whether you're a health worker or not. We also recommend the use of respirators for people who are caring for COVID-19 patients, especially in settings where we have these procedures that are done on patients, but especially in the care of COVID-19 patients. So it's still something that is recommended. I know that there are many questions out there from communities to say, do we still need to do this? Why do we need to do this? But before this pandemic, there was very little data on actually the use of medical masks outside of health facilities. And now there are many, many studies that are out there. We as an organization continue to look at all of the data on masks as well as anything else to update our guidance. But masks and respirators are continued recommendations that WHO has throughout the course of this pandemic, and that has not changed.
Thank you so much, Maria. We are also receiving question from one viewer from South Africa. Sorry, I'm just trying to go back to that question. Yes, Nikkei Pakati, I hope I am pronouncing that well, watching from South Africa. What are the chances of going back to the so-called total shutdown because of increasing infections?
I don't think we're going there. In fact, WHO has never, ever, through the history of this pandemic, advised total lockdowns or shutdowns. It's been one of the urban myths of this whole pandemic. We've always focused on targeted measures to increase physical distance. The whole point here is not to lock down. The point here is to create distance between people who may have the infection and people who don't have the infection. And there are different ways you can do that. As Maria said, if someone is symptomatic and they self-isolate, then they don't have contact with anyone outside. But we know from pre-symptomatic spread, we know with asymptomatic spread, that that's not absolutely perfect in doing that. So even if everyone who was symptomatic isolated tomorrow, there would still be some transmission or still much transmission. So there are different measures that have been used at different times. The idea was to, in many situations, particularly in Europe and in other high transmission zones, where transmission had reached such an intensity that the idea of contact tracing, the idea of isolating or putting contacts in isolation wasn't deemed to be enough given the extent of the transmission. And then governments had to look at non-pharmaceutical measures to create distance between people. And part of that was masking, part of that was reducing the number of people using public transport or shutting down public transport or transport at different times. There were all kinds of different combinations of things used. And we constantly advised countries to calibrate the measures that we're using in terms of the benefits that could be got in reducing the intensity of transmission. And no one ever felt that we could get to zero transmission using those measures. But reducing that transmission in order to take the pressure off the healthcare system was the main objective there. Complete shutdowns and lockdowns, in a sense, were almost a reaction to not being able to apply sophisticated measures in a complex way. It was easier to go straight to, look, everyone stay home. Which is what happens. It's a default setting. And I think we have to get better at that. We need to, for example, in many situations, was it rational to close schools? Education took a huge hit. In many situations where people work on day-to-day, $1 a day, $2 a day, where people are on day work and day pay, it wasn't an option for people to stay home from work. It's fine if you have a government support system that allows you to be paid even if you don't go to work, or if your company can set you up with Zoom and you can do your work from home because you're on a network. But for many, many millions and millions, hundreds of millions of people around the world, that was not an option. So lockdowns had a relatively different impact in countries depending on how prepared the country was to support people in lockdown. The social, financial, and other supports, economic supports that people needed to have in order to stay at home didn't exist in many countries. And this created a lot of resistance and a lot of suffering. So adapting our measures in real time and being agile and trading off the benefit in infection prevention and control against the benefit or downside economically, socially, mentally, psychologically. And we have studies now we're doing increasingly with partners around the world supported by the Norwegian government, really looking at the value of the different components of public health and social measures and the different intensities, trying to come up with better ways. Are there better ways to bring these measures into place that are more calibrated, less severe, in which we can apply measures to reduce transmission that don't necessarily mean that everyone is locked down in the inverted commas sense for weeks and weeks and weeks. As I said, just to repeat, WHO never advised lockdowns in that regard. We understand why governments did it, but we never, as an organisation, advised that lockdowns were the best way forward. But again, countries that were facing huge transmission were having massive numbers of deaths, their hospitals were overwhelmed, and in many of those situations, governments felt they had no other option than to implement lockdowns because they didn't necessarily have the data to be more precise in what they were doing. What they had was hospitals full, ICUs full and overwhelmed. And they had to do something to break the chain of transmission, to reduce the intensity of transmission. So it's very easy now with retrospective scopes for people to look back in reviews and say you shoulda, you coulda, you musta. But a lot of governments were in real time making decisions with less than perfect information around the virus, its transmission patterns, its impact, not knowing where the virus was going to go, seeing their hospital system and their health system overwhelmed. And they made the decisions they made based on that. In most cases, I believe that was in good faith. That was done trying to use the science. In other cases, maybe it wasn't so much so, and people made choices that weren't so good. But I think in the main that was the case. So from that point of view, we need to take that tool. We need to turn what was one big hammer into a set of more precise tools and instruments that allow us to apply measures in a more coherent and systematic and calibrated way in the next pandemic.
And I think we can. I just want to reiterate that because I think we're in a very different situation than we were in the beginning when that blunt force instrument needed to be used by many to help, to care for their health systems. We have a lot of knowledge about this virus now, and we have a lot of knowledge about how the different tools can be applied. I think what Mike points out about how countries can implement them and that agility is very different than where we were in the beginning. And we would like to see some of these success stories discussed. How are countries actually adapting their system now? How are you utilizing the different types of interventions now, given what we know about this virus? And that's what we are seeing. I don't believe that we are going to go back to lockdowns or see any use of lockdowns. And again, it was never something that we wanted to see used. It was something that had to be done in this blunt force instrument to kind of curb the spread and help the health systems around the world. But we're not in that situation again. And I think what we see is COVID being integrated, the dealing with COVID, managing COVID as an emergency is being integrated into longer term systems so that that use of surveillance, the use of a workforce, the use of clinical care, the use of hospitals can be utilized for COVID as well as everything else. We have to remember that, and as Mike pointed out in his last answer, COVID is only one of many emergencies that countries are dealing with. We recognize that. We don't want anyone looking at COVID with blinders to say this is the only thing that you need to be dealing with. We completely understand that. But we also can't forget about what we can do. With all of the challenges we face, COVID has solutions. Let's use them appropriately. And I think if we can do that, and if we can utilize the different levels of interventions, and countries are showing us the way to do that, we can minimize the spread. We can reduce the spread, not prevent all infections or reinfections and transmission. That's not the goal. But what we can do is we can prevent these deaths from occurring. We can prevent overwhelming healthcare systems because of COVID-19. So that those beds can be used for people who need those beds for whatever disease they face. And I think that's the goal that we're getting to right now because this virus is here with us. But countries are smart. We've seen really great ways in which countries have adapted their response. But also, as Mike pointed out, that agility in the system, the ability to kind of scale up, scale down, that elasticity is really fragile at the moment because everyone is exhausted and everything, that we need to be dealing with is urgent. So I think that's what we're trying to ensure, that we have the space to work with member states on.
And I think people find it most difficult to deal with those extremes.
Right.
All open and then all shut down. It's really hard to deal with that economically, socially, psychologically. And I think the level and length, if the more a government considers public health and social measures, or measures short of lockdown, the more severe, or the more disruptive that those measures are, and the longer those measures are likely to take place, the more a government needs to think about the human rights aspect of this, needs to think about the economic and compensation aspects of this, of the social and psychological impact of this, and put in place measures to support communities who may be in restricted movement situations. Too often governments have put that in place and they've not thought about the social, economic and psychological consequences of that on people. And sometimes the medicine has actually been worse than the disease in that sense. And I think that's, so it's really important that that there's that balance there. We're asking communities too often to comply with quite restrictive measures, even short of lockdown. And when we're asking communities to do that, we need to support communities. Very easy to go and say, you must and you should and you must comply with these rules and you must do this. It is very tough in reality for working families, for others, to comply with restrictive measures. And increasingly in the modern world, people don't want to be restricted in what they do. That's part of that natural freedom we all expect. So if people are to be brought in to this kind of process, people need to be, and I saw it, and I saw it certainly happen in my own country in Ireland, that people bought in to the process. They bought into this collective contribution, that this is about us contributing to our collective safety. The idea that we have a responsibility beyond ourselves to our families, and beyond our families to our communities, and that we, instead of imposing so much all of these measures on people, that we see this as a phenomenon in which communities act to protect themselves and protect others. And we empower communities to do that. And the way we do that is by having a dialogue with communities, engage with communities, and invest in communities to be able to tolerate the worst aspects of those measures when they do occur. And I think as we go through the process of planning for any future pandemic, we just don't think about how we calibrate the measures. We also think about how communities can participate, be more engaged, and more importantly, get more support. Because you saw it in a lot of the reaction to lockdowns and to physically restrictive measures on people. People were desperate at times, thinking, I can't go to work. My kids can't get to school. People felt that the damage that was being done by those measures greatly outweighed the risk of the virus. Now, we know the virus posed a huge risk at that time. The health systems were collapsing, but maybe that wasn't explained well enough to people. And as well as that, maybe governments didn't invest enough in the measures to mitigate the impact on people's lives. I think it's we're probably speaking too much about it right now, but I think it's one of the big challenges going forward. I don't expect us to be in that situation again with COVID-19, unless we have a dramatic shift in the virus. But this will come up again with future epidemics.
Thank you so much to both. We are receiving quite a few different questions and very specific ones, so I'm trying to navigate the conversation. Maybe as you are talking about compliance to measures and when governments were putting measures, like strong measures in place, we have a question in current setting from Rubil Syed. She says she's from Bangladesh, and that most of people are not obeying to the rules of preventing COVID-19, and what can we do in this situation?
We're seeing that around the world. So thanks very much for that question. I think what we are trying to do through our member states, through our regional offices, our country offices, through all of our partnerships that we have in countries with civil society, with community groups, with faith leaders, is to really understand what is happening in communities, to listen first and foremost, as opposed to talk to, but to listen, to understand what are the barriers to be able to use some of these tools. And I think if we can address what those are, whether we're talking about the use of masks, whether they're talking about physical distancing or vaccination, or, there's a lot of reasons why certain interventions are not used. Some of it has to do with access, some of it has to do with tolerance, some of it has to do with, we just want to be done with this and we don't want to talk about COVID anymore. We don't want to think about COVID anymore. And I think it's up to us as public health professionals to listen and to really address what the barriers are, what the concerns are, what the challenges are, and work with communities to implement those changes. We say all the time, Mike says all the time, outbreaks begin and end in communities, and it's about people. It's about listening to people and how we address this. It's not about fixing, it's not about correcting, it's not about challenging, it's about understanding, and it's about working with people to really find the solutions together.
Yeah, and I find, even for myself, talk about complying with measures, I really don't know the rules in many places, and I travel quite a bit, and I go from one country to the other, and it's not quite clear.
It's all different.
It's all different. So I just try to apply the basic approach for myself and look at my own risk. So I take the number 8 bus to work every morning. I wear a mask on the bus, but I don't wear a mask walking down the street.
Yeah.
But I wear the mask on the bus because it's winter time. The buses are a bit more packed now because people aren't cycling as much.
Lots of people sneezing.
And lots of other things, right? So I wear the mask on the bus. If I go into a store, if I go into the convenience store at the train station on the way home, and that's usually packed at 6 o'clock or 7 or 10 o'clock at night whenever we get out of here. And in there, you think, okay, I'll put the mask on here. Whereas I'm sitting outside a coffee shop in town, I'm not going to be wearing my mask. So I think it's just applying that. And it's not about being paranoid about the disease. I just don't want to get sick.
Yeah.
I'd rather not have flu, and I'd rather not have COVID, because very busy job, and I just want to avoid being sick, or avoid not being able to travel home to see my kids, or avoid not being able to see my mum, or do all of those things. So I don't want COVID to interfere with my life. So I'm prepared to have a few things I do that reduce my risk. But that doesn't mean I can't go to meetings. It doesn't mean I won't go and have a drink in a bar, but I'd sit outside rather than sit inside. It's getting a bit cold for that now, so the decision is, do I wear a coat and a hat and gloves and still sit outside, or do I go inside? So over a given week, over a given month, my exposure count to the virus, it's a bit like radiation thing, where you wear these things on your lapel and it builds up your radiation count. So my exposure count for the virus over a given week or month, I try to keep down without necessarily stopping my life in any meaningful way. And hopefully through that process, I avoid getting infected. And if I can prolong getting infected for as long as I can, all the better. So I think everyone needs to think about it like that. Governments have removed a lot of the state support for that. It still costs money now to get tested. You have to buy your own masks. There's a lot of, it's not easy to. I can make that choice, because I have a professional salary and I can afford to go and buy 100 masks, medical masks, and do whatever. So it's, but I think most people, no matter what situation you're in, you can make smart choices to try and avoid respiratory virus infection this winter, particularly in the Northern Hemisphere. In doing that, you reduce the chance that you bring it into your own family. You potentially reduce the pressure on the health system should you become very sick. But overall, you're just helping to reduce the overall risk of infection, the overall pressure on the health system. And in doing that, we all make a contribution. It's like climate change. And, you pick up your plastic bottle and you think, what difference does this one plastic bottle make to climate change? And you think, well, I'll just throw it in the regular bin, rather than walk in 5 meters to throw it in a recycle bin. It didn't make any difference, What difference does that make? Well, if that's our way we think about climate change, we'll never change. And it's exactly the same when it comes to COVID. Me putting the mask on a very packed bus, does that really change my overall risk in a given month of being exposed, given the traveling I do and airplanes I get on? Probably not. But if I put all of those little actions together into one, I always wear a mask on an airplane now, regardless of whether the airplane, the airline advises it. I just wear the mask. It's just as easy as not. But it's also, I think about physical distance. I also think about keeping my hand hygiene right, because that avoids COVID and a lot of other risks. So I think it's just that general attention to hygiene, general attention to distance, that allows me to manage my risk. And I think if every individual tries to look at it like that, then we can keep the force of infection as low as possible without having a major restriction on our lives.
But please be kind to others. So others are taking decisions. And if they choose to wear a mask and they are asked to wear a mask, and if they want to physical distance and they're making decisions about sitting outside versus inside, please be kind to others and be compassionate about it. It's about individual and their choices, and they're thinking about themselves and their loved ones. And I think we can't emphasize that enough at the present time. I really do believe that everyone has a part to play in this. And I believe that, you reducing your own risk does have an effect on others, and it helps. And because we have access to these tools, because these tools are affordable, not everybody has access, we should highlight. That's one of the things we've been really focusing on, is to ensure that not only do we have, a strong evidence base to recommend their use, but that people have access to these materials and that they can. But if you see someone wearing a mask, and you see, just be supportive and be kind. I don't think we can also emphasize that enough, particularly in the current climate that we all live in and all of the challenges that we face. We don't know what every situation everybody has. We don't know what everyone's family situation is, and it matters of you being supportive of that.
Yeah, I had a colleague, a very good point, Maria, because I remember relatively recently been at a big international meeting, and a colleague of mine was wearing a mask everywhere. And even outside and inside, and I thought, I wondered, and it looked out of place in some of the settings. And I remember at one point just saying to them, I hope there's nobody vulnerable in your family. He said, well, exactly, that's why I'm wearing the mask. I have an extremely vulnerable relative, and I really do not want to bring this virus home. That person was actually doing all of that sort of mask wearing and all of the inconvenience, and maybe eyes increasingly looking at them as the only one in the room with the mask on. And they were taking all of that on board very quietly, without any noise. They didn't have a sign up saying, I'm protecting someone at home. And I thought it was very admirable, because, it raises eyebrows now to be wearing a mask in a situation that seems incongruous. So when you see someone wearing a mask in a situation where you don't think it's appropriate, don't think that they're just trying to draw attention to themselves. They're probably protecting someone very important in their lives who's vulnerable.
Thank you. Here is a question, again, very specific to mask usage, but it's about immunocompromised people. So the question comes from Roxana Randon, who is asking if it's okay to eat food that is made by someone who is not wearing a mask if you are immunocompromised.
So that's a very specific question, and it's a good one. I mean, we look at multiple ways in which this virus can be transmitted. We haven't seen this virus transmitted through food, through contaminated food, through ingestion of food. So there's a lot of protections that are in place for people who work in restaurants, who are preparing food. There's a lot of ways in which that is done safely, and regulation around that around the world. And I think for immunocompromised individuals, it's important that you take steps to keep your risk low as possible. And one of the ways in which we encourage is through vaccination, to make sure that you receive the full number of doses that are required for you where you live and based on your individual situation, but also taking other measures in place, wearing of that mask to prevent the spread between people, if COVID is around, and COVID is circulating as well as other respiratory diseases. So you can live your life, but again, it's about knowing what your risk is where you live and the things that you do throughout your day, and taking measures to lower your risk.
Thank you. Here is the next question from Selena Mao, because we have quite a few more, and I will try to speed up. How to assist chronic disease elders to return back to social life? They have been living in a very restrictive lifestyle this far, socializing only with less than 10 people within the social circle.
Yes, it's not an easy one, because we know that, particularly for people with the very older age group, we know that even with infection, that the immune memory for infection decreases very rapidly. Even with boosters, I think we've seen reinfection rates in those over 70 particularly, or over 80, quite high, even with full vaccination. What we are seeing, though, is the rate of severe disease in ICU holding. So it's protecting against very severe disease. But it's still, if someone over 70 or 80 gets a very severe infection, the consequences of that are not good. So I can see the reason, the question is someone with a deep underlying vulnerability due to immunocompromise or due to being being much older, is not easy. So it is a trade-off. I see it with my own relatives who are older, that going in my aunts and others are, very religious people. They want to go back and reconnect with communities of faith around the world, and you want to go back to wherever it is. You want to go to the church, you want to go to the temple, you want to go to the synagogue, you want to go to the mosque. And that means connecting with people. But if you're an older person in many societies, that's where there is a deep connection with other people. And to lose that connection completely at a time in your life when you're reflecting on your own life, you're reflecting on your own existence, you're living life through memory sometimes, and through reminiscing with friends and so that's a hugely important part of the life of an older person. God, once we're getting old, I'm thinking about it. But I think that's the trade-off. So finding ways to re-engage in social life for vulnerable people is very important, but maybe having extra protections in place, so not having so many people in a room at one time. But the idea of the idea of having large scale family celebrations, for example weddings and funerals where you have maybe a couple of hundred people together indoors, in the context of active transmission. And I saw that certainly over the last number of weeks in my own country, seeing funerals and those kinds of events, resulting in many people being infected. And people say, well, it's all right, we're all vaccinated, that's fine. But maybe not all right if you're an older, very old person who's had a vaccine 5-6 months ago, who may actually be re-exposed, reinfected, and potentially could have a severe infection. So it's really hard to answer the question because I can see the dilemma. So what I can see, it's down to each individual, has to look at their own risk. They have to look at their own life. If there's a really important family event that you don't want to miss, there's things you can do to reduce your risk and reduce your exposure during that time. Wearing a mask, yeah. And I've done it. I have a very, very good friend of mine who has cancer right now, and he has to think of every single thing he does, every event he attends, every football game, every time going to a bar. He was 60 years old recently, and he had to try and decide, I want to see my friends. It's a very important thing, but should I have my party inside or outside and inside, which it turned out to be? And can I sit outside for most of the time and engage people outside rather than standing inside the whole time? And that's what you have to do. You have to be, I suppose, what I do day to day to try and reduce my risk. Someone with an underlying condition, someone who's very old, has to actually apply that matrix much more stringently to try and keep their risk to a minimum. And most importantly, vaccinate. Someone in that category should be super vaccinated with the maximum number of doses that are advised in the given jurisdiction. So I think that's where the answer lies. But it's a real, the idea that someone with a severe vulnerability, particularly a severe vulnerability related to age, the very fact that they have to cut themselves off from their families and their communities is heartbreaking. We saw so much heartbreak during the pandemic. So my own personal view would be, people need to get back out there. They need to reconnect. But what we need to do is put the maximum amount of risk mitigation in place so that it can be done without people feeling they're losing their contacts, but at least there's some kind of precaution, particularly in attending large-scale indoor public events. This winter, if you're attending large-scale indoor public events and you are a vulnerable person and you are not vaccinated, you are at risk. You are at serious risk. If you're doing that and you're fully vaccinated, you're probably at much less risk. So I think it really depends on what your vaccination status is, really determines what your risk status is, no matter what activities you decide to engage in or not.
Thank you so much, Mike. Here's the next question from Lokmani Gupta, who is saying that She's suffering with post-COVID neurological complications. She's taking proper treatment, but no impact. She's asking if it is reversible or she'll have to suffer like this for the whole life.
Well, I'm glad you're getting treatment, and I'm glad that you're seeking clinical care and someone is looking after you for what you are suffering from. First of all, I'm sorry to hear this. We know that there are a lot of people that are suffering from post-COVID-19 condition. There's a lot of work underway to really understand so that we can have better treatment. So there's a lot of research that is underway, not enough research, not enough funding is being used or being provided to study post-COVID-19 condition, to look at all of the different medium to long-term effects. And we as WHO really advocate for this. We thank those who are working in this area. We thank funders who are putting funds into this, but this is something that requires investment. So I think, what we are learning is that many people who have post-COVID-19 condition are recovering from that. And I hope that you are one of those and that the treatment is successful and that you are getting your life back. But we are seeing that people are seeing some positive effects of the treatment, but we know that more can be done in this area. So I think it's really important that you who are out there who are suffering from post-COVID-19 condition know that this is a priority of ours, working across all of our clinical networks, working with many different specialties for adults and for children to better understand what post-COVID-19 condition is, in the hopes that we have much better clinical care for those of you who are suffering from this. But this is something we will continue to work on.
So much, Maria. We also had a question in terms of mutations of the virus. So maybe you can give a brief update on the current variants of concern or like subvariant that we are tracking the most.
Sure. So we still see Omicron as a variant of concern dominant worldwide, and the number of subvariants is similar, if not growing. So more than 300 subvariants are circulating worldwide. I want to preface my comments about these variants is that we have a limited amount of information about the subvariants these days because surveillance has declined, testing has declined, sequencing has declined, and that means there's less data to analyze. About 80% of the subvariant of Omicron that is circulating are BA.5 sublineages, of which about 28% of this is the BQ.1. So BQ.1 is a BA.5 sublineage, many sublineages that are circulating. And it varies worldwide in terms of the proportion of what subvariant is circulating. We can say that there isn't one subvariant that is dominant worldwide. And so it's important to mention that because we need to have good surveillance around the world so that scientists, public health professionals, virologists, and many scientists with different disciplines can analyze these over time. All of the subvariants of Omicron have a growth advantage, meaning that they're highly transmissible compared to other variants of concern. Many people have been infected with multiple subvariants of Omicron, BA.1 or BA.2, and now maybe BA.5 or BA.275. I think what's important as individuals out there is that the virus is circulating, and you need to take measures to protect yourself. Protection against severe disease and death is very strong if you are vaccinated and if you have the full number of doses. And COVID-19 vaccines that are in circulation right now, the vaccines are highly effective. So whatever is recommended for you, whichever booster is there, whichever additional dose is recommended, please get that vaccine. It will protect you. It will save your life. We are hoping for more vaccines coming down the pipeline that could actually look at infection and transmission, but those aren't available yet. So there's a number of variants that are circulating. We update these each week on our website and with our weekly epidemiologic record. There's details for each one on growth rate, on immune escape. I should say that none of the subvariants of Omicron show a change in severity. So we do see the same risk factors for severe disease. Those who are of older age, those who have underlying conditions, those who are not vaccinated are at an increased risk for severe disease and death. And that's important. So get vaccinated when it's your turn. Please take measures to reduce your risk of infection because the virus is circulating pretty intensely around the world. So again, we're tracking this. It's a long answer, but I can give an even much longer one if we go into each of the subvariants. But I think it's important that people out there know that there are many around the world who are focusing their time and effort on tracking this variant, looking at the different characteristics of each of the subvariants in terms of transmission, immune escape, severity, and the impact of our interventions. We have specific technical advisory groups that are advising us on each of the characteristics of these subvariants, our tag VE. We also have our tag COVAC that is looking at vaccine composition. What is important for you out there to know is that the vaccines work against preventing severe disease and death. So please, if you hear anything today, please get vaccinated and make sure that you receive the full number of doses. Don't wait. Don't wait for the next vaccine that's coming down the pipeline. Get vaccinated with the ones that are available to you.
Thank you. And maybe this is a question we can close the session today from Abdul Hamid. What's the likely course of the pandemic in near future? And especially if you look into end of the year holiday season coming up and people traveling and gathering to celebrate, what can we expect with this virus? This is the third year actually that we're gonna start the end of the year celebrations in the pandemic.
I think we're beginning to see that seasonal impact in terms of people going inside, indoors, increased intensity of transmission. So, and I think because vaccination doesn't necessarily fully protect you against reinfection, I think we'll definitely see in the Northern Hemisphere an intensification of transmission. Not that we'll detect it so well because we're doing so little testing. It's very hard to actually track that right now. But I think we'll definitely and are seeing increases in transmission. What we are though seeing is that in highly vaccinated populations, we're not seeing a consequent massive rise in hospital admissions, ICU admissions, or death. So again, we come back to the biggest factor in determining transmission, maybe proximity and people gathering, but the biggest factor in determining whether you get infected or get very sick is vaccination. So in a sense, if we look at season and vaccination coverage, they're probably the two things that will interact. The season in the sense of determining, and then there's the issue outside the season is how much people do go inside in general. So in tropical countries, it may be that people are more inside in the height of summer. So that's another issue. So I don't know if the virus has settled down into a truly seasonal pattern. It's certainly in a pattern where it exploits density of human population, and where populations are densely gathered together, particularly if those people are under vaccinated, you will see increased transmission. And then in a context of increased transmission where you have poorly protected vulnerable people, in other words, vulnerable people, older persons, people with underlying conditions who are not vaccinated or are under vaccinated, then you're going to see pressure on the health system. So that's the kind of pattern I predict. It's, if you look at any country and say, where are we in the season? How much are people going indoors? What's the vaccination level of those individuals? And how strong is our health system going to be able to cope with an increased demand? If you put those three questions together, you probably get a sense of where a country could be in 2 or 3 months' time. And that's notwithstanding any major change in the virus. And I'll hand over to Maria for that, because that it really is Las Vegas in terms of the lottery. That's the lottery. We don't know where that's going, but there's certainly tremendous pressure on this virus, and it continues to evolve.
And I think that's it. I think we are incredibly hopeful, right? We are in a different situation now in this third year of the pandemic. We can find ways to gather. We can find ways to celebrate that are not as risky as they were before. We have population level immunity, which is very high. We just published this global survey looking at this, of looking at population immunity over time from infection and or vaccination. We have tools that, can keep people alive and prevent infection and reduce that risk when you do gather. But the big wild card, the big uncertainty is the virus itself. We expect there to be some predictability, some seasonality, and we're starting to see a little bit of it, but it's not settled down yet where we can predict with certainty about what will happen. And the sense where we expect a wave at this time point, it's still not, it's a very different virus to influenza. It's similar in the sense that it passes through the air. It's a respiratory pathogen. There's a lot of similar tools, but the virus is mutating and it's changing. And in many parts of the world, it remains unchecked. Transmission is unchecked. So a couple of million cases being reported each week. In some countries, that estimate is 5 times higher. So, we're not out of the woods yet. And I think that other danger that we have with that uncertainty is that people really don't want to talk about COVID anymore and just say, please, we have so many other things that we have to deal with. We don't want to deal with this. What we're trying to do and work with all of our member states is to right size this response, make sure that we don't forget about COVID in the context of everything else. So we're hopeful. We're hopeful that we will continue to see trends where cases do not result in death, and we can do that. We are hopeful that we can utilize the tools that exist and provide access to these tools, better access to these tools around the world. We're not there yet. So there's just more work to be done. We have to remain vigilant. We want you out there who are celebrating holidays, whatever those holidays are, whether it's my son's birthday tomorrow or, the holidays coming up in the new year, to do those as safely as possible. Use what you have access to. We are working with governments to ensure that they provide access to these, that they have a rational response, a comprehensive response for COVID and everything else that is circulating. It's very difficult right now to balance all of this, but we're here to work with countries on that. But the virus still is not predictable. And I think that's why we need good surveillance so that people can be looking at this every day. You out there shouldn't need to worry about that, but we as public health professionals and scientists need access to that information. So thanks to those of you who are working on COVID, who are continuing, and for those of you who are playing your part, we need you. We need you as part of this response, and we're very grateful for everything that you're doing.
Thank you so much. Oh, Mike?
I just wanted to go back on because the person who asked the question about neurologic condition, post-COVID condition, and I didn't say anything. I just didn't want that to be interpreted as anything other than Maria had said it pretty much all. But I just want to say to everyone out there, especially those people who don't have, and you're lucky enough to either not be infected with COVID-19, to be protected by vaccine, and get a mild infection, to get a severe infection but not have a post-COVID consequence. Great, that's fantastic. But there are many, many people out there who have variations on this post-COVID condition. We believe it's a mixture of people who've had a direct impact during the infectious period for which they're finding it difficult to recover, or people who have a condition in which they've got dysregulation of their immune system after, they've got impacts, autoimmune, immunologically based inflammatory processes in different organs, be it this person mentioned the neurologic system, and it's very real, that fog, that difficult. There are so many different neurologic impacts and neuropsychiatric impacts of the virus. Some are direct in that, and some are related to other things. COVID can cause problems in your vascular system, in your blood system, and therefore people can have strokes, or people can have problems that then lead to neurologic complications. Some people, viruses really haven't been found that much in the brain or in the neurologic system. Generally speaking, your brain and neurologic system is highly protected from infectious agents. In fact, it's an amazing system, and we talk about the blood-brain barrier, and the fact historically and from an evolutionary point of view, our brain and our neurologic system is more than any other organ in our body. That system is protected from infection, and very few infectious agents ever can cross that barrier. But what can happen is inflammatory processes can be triggered, which can then cause problems in the neurologic system. So I just want people out there to realize that this post-COVID condition, long COVID, whatever, it's real. And people who are suffering with this should not be ridiculed. They should not be looked at as, in some way, people, they're just on the lam. I've heard people say this, they're off work for the last 6 weeks. Why, and I don't think we can build up this kind of prejudice. There's been enough exclusion. There's been enough othering in this whole COVID response. There's been enough marginalisation and enough breach of trust that what we need to do is recognize that, a proportion of people who've been through COVID infection are suffering long-term consequences. And they need support, number one, from their families, from their friends. And we need more research to understand these pathways, because they're not simple, straightforward pathways. There's many interactions between the neurologic, the neuropsychiatric, the vascular, the respiratory part, and how all that plays out for any individual is complex. But understanding how we can find therapeutic pathways in order to help people number one, help people recover completely, and then help people cope with any subsequent limitation will be very, very important. But to the person who asked the question, for the vast majority of people, they make a slow, gradual progress towards recovery. So it's about length of recovery. So I wouldn't give up hope. Keep doing what you're doing. Try and stay positive, and hope your body and your immune system and everything can recalibrate and readjust in order to find a way for you to live a wholesome and productive life, and that medicine and science can find the solutions for that small proportion of people who continue to have long-term symptoms. But we need to invest in that. We owe that to that group. But please, out there, if you know someone who has post-COVID condition, who's struggling right now, it's real. It's not a fake, and we need to offer those people our best support.
Thank you so much. I think this is a beautiful message to end with. It arrived earlier during our conversation from Anne Badger, who says, "Thank you for all your work, dedication, and effort to control this pandemic. You are all heroes." And I also thank to all the viewers who are watching us from Kenya, Sri Lanka, Iran, Poland, Morocco, Ireland, Syria, Cambodia, Angola, Brazil, Cameroon, Mozambique, Canada, Georgia, Pakistan, Switzerland, the Netherlands, Tunisia, and there are many more countries, so we are running out of time, but I really thank you all for your questions, for your time, and please take the advice from Mike and Maria to know your risk and manage your risk so that we can end the pandemic, but also to celebrate the beautiful moments that are ahead of us. Thank you and goodbye.